morning, everybody. I'm Birch. I'm a spinal specialist working primarily in rehabilitation now, having once been a surgeon. This is the first interim analysis report of the RAPID trial. It's a prospective trial looking at functional exercise in a robotic exoskeleton. I'd like to acknowledge my co-authors and also the financial support from BritSpine, and we all are declaring our interest there. The background to this study is that upright activity, particularly with walking in patients who have spinal cord impairment, has a number of physical and psychosocial benefits and massively can improve the quality of life. So robotic exoskeletons or powered walking aids can be a very useful tool in terms of rehabilitation and personal activity for patients with spinal cord injuries. At the moment, there are essentially two groups of devices. There are the 4-point gait walking aids, such as the Exo, Rewalk, and the Indigo, and then the independent Rex device, which is a self-supporting powered walking aid, and that you see the second organ here. The study itself was predated by RAPID-1, which is a proof of concept study which showed that it was safe to get patients into the device and exercise. RAPID-2 is a probably constituted study. It's registered on the clinicaltrials.gov website. It has a research authority from the East Midlands Ethics Committee and an independent CRO. We are recruiting in the East Midlands at the Chris Moody Centre, also at the RMH, East Kent, and also two sites in the Southern Hemisphere, one in Australia and one in New Zealand, with another site in New Zealand coming on stream. Our primary research question is Rex safe to carry out functional exercise for patients in a rehabilitation setting? We're looking at the completion of transfer to times and the ability, and then the ability of the patients to carry out the Rex exercises, that is a functional exercise in the machine. And our adjunctive primary outcome is a serious adverse events. Secondary outcomes are a timed up and go test, as well as the ability in first use to achieve autonomous control of the device. And then there is a patient questionnaire to be completed at the end. As you'd expect, there are more men than women in this study because of the demographics of spinal cord injury. 3/4 are paraplegic and 1/4 tetraplegic, and there's a 50-50 split between complete and incomplete. These are patients with chronic spinal cord injury, the median time from injury of 8 years. So the results of the first transfer is that it's a reasonable time to transfer of just over 7 minutes, with a maximum of just over almost 17 minutes. Only 50% of patients, or 50% patients, only need one person to help them transfer into the device, which is of some utility. 19 out of 20 can complete the exercises. And then the timed up and go test, just over 5 minutes as an average. And when you heard earlier the frailty talk, we're talking about 20-25 seconds for a frail person. You can see this is a different order of magnitude. In terms of assistance, many of the people can manage with just one. So we have very good subjective feedback from the quality of life questionnaires, as you can see from the green lines. And in summary, the interim analysis of RAPID-2 shows that Rex is a safe powered walking aid requiring limited amount of user training, particularly compared to other devices of a similar nature. It allows patients with spinal cord injury to benefit from physiotherapy when standing, walking, and it has a significant role in neurological rehabilitation now and in the future. Thank you very much.
Any questions?
Nick, I think this sounds quite exciting for these patients, and I just wonder if there's any sort of research been done into how the users find them in terms of quality of life, acceptability, where it's going to go.
Right, so the research so far, Elaine, has been some good psychological research from Sweden looking at people who are using standing frames with spinal cord injury, and that showed positive benefits for quality of life. There's been no research yet looking at quality of life in powered walking aids. As part of RAPID-2, we had a protocol amendment, and our second tranche for the interim analysis, when we reported the next 20, will include quality of life assessments, including an EQ5D, a spasticity score, sleep disturbance, etc. So we address that distinctly and absolutely appropriately in the second revision protocol. If you want to see it, it's on level 1. Simon will demonstrate it to you.
Any more questions?